guys, this is Dr. Denny Warren with Generations Health and Wellness Center in Fayetteville, Arkansas. And I want to give you guys an analogy with chiropractic and medicine. And I also want to use that analogy with the fire department and a carpenter. Because, you know, there's value in all of those things. There's value in all those professions. But a lot of times there's confusion about who should I turn to for what. And this analogy has really helped me and really helped understand. And, you know, in my family, we have 18 doctors in our family, and we have them, osteopaths, medical doctors, dentists, pharmacists, chiropractors, physical therapists. I mean, it's just all across the board. So I've been able to see a lot of, there's pros and cons to every single one of them. And so here's what I want to do. I want to give you an analogy that helps, I think makes some sense of it and clarify it a little bit. So I want you to imagine that your body is your house. And if you have a time in your life where your body or your house is on fire, it's an emergency situation, who's the first person you should call for that? First person you should call is the fire department, right? And so in this analogy, the fire department is going to be like medical doctors. Absolutely call a medical doctor. You should go to the emergency room because they can save your life. So here's what the fire department. If your house is blazing on fire, you need to call the fire department. You call the fire department. When they get there, what kind of tools do they have to help you? The tools that they have, they'll have axes, they'll have fire hoses. They might have other things as well, but let's stick with axes and fire hoses. And so when they get there, what they're going to do is they're going to take their axes, they're going to bust out all of your windows, they're going to bust out your door, they're going to bust holes in your walls, and they're going to spray everything down, soak everything down to get that fire out. And if they made it early enough, if they got to that fire early enough, then the life of your house, the health of your house will be saved. And we should be grateful for that. But think about it, when they leave, what's left over? You have a total mess. And again, it's not the fault of the fire department because we're grateful. When you think of a medical community, emergency rooms, what type of tools they have? They have axes, they have fire hoses, they have drugs and surgery, right? So they'll come, and if you come at them with a fire blazing in your body, with an extreme poor health state, an illness state, disease state, they're going to give you the drugs and medication. They're going to give you the surgeries if you need it. They're going to give you those things. And if they get there early enough, they're going to save your life and they're going to save your health. And we should be grateful for that, and we are grateful for that. And America is one of the best places to be in the world as far as emergency care goes, and I'm grateful for that. But when we're left over, so when you've had all those surgeries, when you had tons of medication, what are you left with in the body? You're left with the same thing that after the fire department leaves. You're left with a mess. So the idea of the next day when you wake up and you see your house is a total wreck, a total mess, you're not going to call the fire department to come back and rebuild and to improve the health and vitality of your house. You're going to call the carpenter. And really the carpenter's going to have the right tools. He's going to have hammers, he's going to have nails, he's going to have saws. He's going to have all the right tools. That's going to really help you to rebuild the beauty of your house and the health and vitality of your house. So with your body, if your body is run down, if it's been beaten down, if it's been sprayed with fire hoses and or drugs and surgery, and you want to bring the health and vitality back, we don't need to continue to take drugs and surgery. Those things can save your life in an emergency, but they've proven not to be effective at all as far as restoring us back to health. They don't restore you back to health. And so you need to go to people that are the carpenters. As a chiropractor, we are carpenters because what we work with, I can't do much if you have a big fire in your house. I can't do much for those big emergencies, those life-threatening emergencies. But what I can do is I can help restore the health and vitality of your body. And really that comes through the chiropractic adjustment, increasing that nerve flow from your brain down the spinal cord, out the nerves, to all of your body. Your body has to have that. We can help your body heal. Your body's designed to heal itself. It's designed to restore and to function. But we have to have that healthy communication from your brain to your body and your body back to your brain. It's absolutely essential. But we also can help you restore the life of your house through the education leadership as far as good nutrition, good exercise, and healthy thoughts, positive, loving, grateful, gratitude thoughts. All of those things, that's the hammer and the nails, that's the saw, that's the tools that's going to help your body rebuild. And so the thing is, it's absolutely essential that you understand all of these different fields have their place and they're extremely valuable, but we all have limitations as well. So as a chiropractor, as a carpenter, don't call me when your house is on fire, when you're in an extreme situation. Call me when you want to rebuild the health of your house, restore the vitality and the life of your house. That's when you call me. Don't call a medical doctor when you want to restore the life and vitality of your house, but call them when you're really in a sick state and you're in a disease state and you're wanting to stop it from getting worse. You want to stop that degeneration. That's a great time to do it. And then start adding in all those lifestyle things that's going to regenerate. Instead of just stopping the degeneration, it's going to actually regenerate your heart. There's tons of research on this. There is absolutely tons of research on this. Dean Ornish is one place that you can look up online on YouTube, but he's showing people regenerate with lifestyle, whereas he's a cardiologist. He used to give medication after medication. The best he could ever hope for was saying, hey, we stopped your heart from getting worse, which is great, it can save your life, but you really need to regenerate. So I hope this helps you understand the differences. And if you're interested in rebuilding the health of your house, the health of your body, then give us a call. We'd love to help.